Warm greetings to everyone. Myself Anita Patania, and I'm explaining my poster on the topic mental health must not be ignored. So, firstly, I'm explaining abstract of this poster. The first ever global outbreak of COVID 19 has been intensely impacting humanity and continues to affect all segments of the population since its origin. While dealing with such public health emergencies, the past experiences have testified generalized public fear and anxieties due to uncertainty, fatality, and lack of public health preparedness. So, the aim of the poster is to explore the impact of unprecedented environment on mental health of individuals and community in its current magnitude. So, next here I'm explaining graph of one of the case of USA studies, that how worries and stress related to coronavirus had a negative impact on their mental health. So here the percentage is explained. Like in March 2020, the percentage of people who feel worry or stress about the coronavirus and also had a negative impact on their mental health, that is 32%. And in next early April, 46%, and in May 2020, this percentage increased to 39%, and in July 2020, this would be uh, 53%. So almost 20% of Indian population will suffer from some of the mental illness by 2020. So here one of the next report, next case is also explained on mental health. The news report, which interviewed psychiatrists of leading hospitals in New Delhi, explained that a depressive patient had started complaining of anxiety related to fear of COVID 19. Some patients expressed the fear of contracting the infections, while others expressed uncertainty related to losing the job or a family's disturbances, as we all know. The experts expressed concerns over rising level of disharmony and discords in the family atmosphere due to lockdown, lack of social connectivity for patients, and withdrawal symptoms for alcohol and substance users who are habituated and dependent on any substance. So, in this figure, explain the psychosocial interaction and implication for mental health in the COVID 19 era. Uh, some of indirectly or directly way, formal sector and informal sector give rise to unemployment to the many companies and for other, uh, which ultimately cause the inequality. And also quarantine and lockdown period creates social isolation, and some of the violence activities in the domestic household creates the psychosocial stress, which leads to ultimately mental distress or mental illness, deficiency, irrational behavior, family disintegration, and maladjustments. So, one of the potential triggers are also explained, uh, that triggers the mental health. Just like lockdown measures requiring children to stay indoors can impact their mental health negatively. Isolation during lockdown can exacerbate psychosis in patients with existing mental disorders. Social stigma and discrimination can be associated with SARS CoV 2, including towards persons who have been infected, their family members, and healthcare and other frontline workers. Fear of losing livelihoods, not being able to work during isolation, and of being dismissed from work. Fear of being socially excluded or placed in quarantine because of being associated with the disease. So, with this, I am concluding my poster. The government and the people must come together to protect the mental health of the population. Engaging practices like yoga, mindfulness, fun, indoor games, healthy diet, and healthy routines for both children, adults, and elderly is important. Awareness in the media and self identification tests in local languages across the states must be provided. Steps should be taken to address stigma and discrimination at all phases of the COVID 19 emergency response. Integrate mental health and psychosocial considerations into all response activities. Consider and address obstacle to women and girls access to psychosocial support services, especially those subject to violence or who may be risk of violence. Thank you.